Hello and welcome to the BloodStream podcast, a show serving the greater bleeding disorders community, brought to you by Believe Limited and BloodStream Media, and made possible thanks to our presenting sponsor, Takeda. I'm your patient, advocate, and host, Patrick James Lynch.
And I'm your healthcare advocate, nonprofit nerd, and your other host, Amy Bradford, reminding you to please speak with a treatment professional before making any treatment decisions.
Yeah, that's what they are.
But it's a treatment professional.
It is. You know, the word healthcare is on the paper. The word treatment came out of the mouth.
Every
and
time
it works.
I say that, and I don't look at my thing, I screw up that sentence.
You flip it. You say treatment instead of healthcare.
100% of the time.
It's funny, those things that just kind of plant themselves. Anyway, we digress. On today's show, we're closing with more than non sequiturs. We've got the final I'm Fine segment of 2024 with Michael Bishop, made possible by Sanofi. Oh. And we've got the first ever, I'm getting surgery segment with Max Feinstein, sponsored by no one, BloodStream, where we talk to Max about surgery. We've got all of that and more on this, the final episode of 2024. Welcome to BloodStream.
Hey, thank you for listening. As always, happy holidays to you
and yours. Happy holidays.
And your family. I hope you're on break. I hope you're loving it. If you haven't shared this episode with your friends and your family, do.
Yeah, get off your break and share the episode.
100%.
It's
also
in the
subscribe.
Holiday spirit. That's also very holiday spirity. Also, I want to remind you, in the spirit of the holidays, that the BloodStream podcast is made possible thanks to the generosity of our presenting sponsor, Takeda.
Hear, hear.
That's right. Takeda. Takeda's got this website, bleedingdisorders.com, where you can learn all about Takeda's resources for and commitment to the bleeding disorders community. They're not going to leave you hanging with the resources without knowing why. Takeda believes in a world free of bleeds. Can you believe that?
I love that vibe.
And they are dedicated more than ever in their efforts to offer a wide range of support to help patients on their treatment journey, wherever on that treatment journey they may be. And you can learn more by simply visiting the website, bleedingdisorders.com. One more time, that's bleedingdisorders.com. And for their founding and ongoing support of the BloodStream podcast, headed into 2025, I would just like to say thanks, Takeda.
Thank you, Takeda, so much.
Oh, we appreciate it. And here we are, the end of our year, Amy Bradford. We have, some of us have gotten married this year and changed our name.
Me.
Some of us have gotten these glasses.
Love.
Me.
Yeah.
So similar milestone. Do you have any BloodStream podcast moments from 2024 that you will forever carry with you into 2025?
Yeah. Actually, to tell you the truth, my favorite thing that has happened this year in the BloodStream realm, I think, and this is super cheesy, but it's been meeting all of you in person. Like, this year, more than any other year, I have had so many people come up to me at events that we've been regionally across the country, at national meetings. There have been so many people that have come up, and everybody sometimes is a little shy, and they're like, I listen to the podcast all the time. It's kind of weird to see you in person. And it's really dear. And I think sometimes we sit here and talk thinking that we're in a vacuum, just in our little space. And it's really lovely to know that y'all are listening and that we're all in this together. And it's a conversation between pals. So anyway, it's been a joy to meet all of y'all this year. It really has. It's like made my day. So if you see me next year in 2025, please come up and say, I listened to the podcast. That would make my day.
Ditto.
What about you, PJL? It's been a good podcast year.
You know, it's neat. Each year there are the things we couldn't have anticipated that we have to make a decision about. How do we cover this, talk about this, how important is this, and blah, blah, blah. We started this year with big organizational changes from the two national organizations, and I think being able to introduce the community to each of the new leaders was pretty important.
Yeah.
I also really enjoyed having the team from What We Wished We Could Be here. And
what
to have
fabulous conversation.
I thought so too. To have a short film that has such a neat usage of a couple affected by hemophilia and contaminated blood product was really special. And that we were part of their press tour as they were having their LA premiere. It was kind of serendipitous the way it worked out scheduling wise. It was lovely to meet them, and it's just an opportunity and a moment that would not have occurred were it not for this podcast and a blood brother in Europe saying, hey, this film, they're coming to LA. Can I connect you? Yes. And, the network and the community working its thing. And I've heard from a number of people, to your point, about folks coming up to us who were introduced to what we wished we could be because of the BloodStream podcast.
Yeah.
So it accomplished the goal of expanding the awareness base of the film amongst the U.S. audience. So that's really cool. And I'm excited knowing the known unknowns of 2025 are coming.
That's cool.
And I am excited to see what they are.
I know, me too. Me too.
But the known of right now is that we have our final I'm Fine segment exploring entrenched resiliency with Michael Bishop, and that is coming up right now.
I'm Fine aims to challenge entrenched ideas around chronic resiliency and satisfaction with suboptimal outcomes by inspiring people with hemophilia to seek education and truly consider the possibilities. Sanofi seeks to expand the idea of what's possible for the hemophilia community. Take a deeper look at the science behind hemophilia and an important connection between factor activity levels and potential activities at levelsmatter.com. Now let's get to I'm Fine.
Hey everybody, it's Michael Bishop again, and this is another segment of I'm Fine. Today we're going to be doing something a little bit different. Usually I have a script in front of me and I'm reading it, and it's something I had written a couple days before and gone over and had thought about a lot, but today, because of the subject matter, I'm kind of going to approach this with a little more candor. We're going to be talking about anxiety today, specifically hemophilia-induced anxiety, or at least my experience with my hemophilia giving me really bad anxiety. I think generally speaking, I'm a pretty anxious person. I'm a bit of a dork, and so social situations or public speaking, anything like that, I think I have an above average level of discomfort. However, that is not necessarily the type of anxiety I'm going to be talking about today. And I'm also not going to be talking about the very understandable and natural anxiety that comes along with having bleeds, because I think that's totally normal and it's okay. And in my experience, it's not particularly debilitating. And I think if you explained hemophilia to anybody, if you explained bleeds to anybody and said, I have some anxiety around these things happening, they would say, yeah, of course you do. But rather the anxiety I want to talk about today is something I experienced in my early to mid 20s, which is some panic attacks that came along with my bleeds, which sounds so weird because they're things that I've experienced my entire life. I thought I had a complete handle on my hemophilia by that age. I was living alone, having a lot of bleeds, but like able to treat them by myself and, cook with one leg or one arm or whatever it was. I thought, okay, I can, it still isn't fun, but I'm like an adult and I can handle this stuff, But then suddenly I noticed myself going into a real panic when I felt a bleed happening, and it wasn't a normal or manageable panic. It was not something I'd ever experienced before. And in the years since, I've tried to deconstruct it a little bit. And I think I was feeling the results of joint damage more than I did when I was younger. Certainly when you're young and have a, super strong body, you get a bleed, you treat it, you bounce back just as high as you were before that bleed started. That's the metaphor I always used with my friends. Like, you're a little ball and someone drops you, you bounce. They don't even have to move their hand to, reach down to grab you. You bounce right back up to where you were. And I think for the first time I was feeling myself not getting that high anymore, not reaching the same, not going back totally to normal, as it were. I could feel the degradation of my body, which is really scary. And bleeds were the reason that was happening. And so when I felt a bleed coming on, it was not just, I have to deal with this bleed. It's playing the tape out. And as my friends and I say, future tripping, and like thinking, okay, I've had X number of bleeds this year and my body is, this much worse. That means in 5 years, I can expect to be this uncomfortable or whatever it is. Like I was just so consumed with not just this bleed, but what this bleed represented to my overall health and to my overall ability to get through the day, And so there I was at 22 or 23 or however old I was, living on my own and doing my own thing. And it felt like I had regressed in my ability to take care of myself. And selfishly, annoyingly, it was like, okay, I have this bleed, but then I have this other thing I have to deal with because it's making me panic all day. And I might, think something is worse than it is, or shortness of breath, or I can't see anybody or talk to anybody. It was like, it was affecting my life separate from the bleed and making it all the worse, which is why I knew I needed to address it or fix it. And mental health, as we say a lot on shows like this, and I know people on BloodStream have talked about this a lot, but mental health stuff is not as clear cut as hemophilia is, or something like that. It's totally different. It's not, this thing is happening and I can see it and I can feel it very directly. I'm going to do my medicine. Bob's your uncle. We're good. It's something, it felt much more abstract, and it felt like something associated with my hemophilia that I was ill prepared for. I didn't know how to handle this thing. And it was a challenge for which I was not particularly ready. And I hope in talking about it, I can connect with you in some way. If you are feeling additional anxiety as you age with your hemophilia, I think, I and many people like me think, okay, I'm old. I should only be getting better at dealing with this, and any step in a different direction or any evidence to the contrary makes you feel like you're failing in some way or regressing in some way, when instead it's just, there's an additional obstacle here, or, it's harder to fight now. I'm older. I'm tired. Whatever it is, it's not a failing. It's not even, it's just a continuation of your journey, And I wish, like with all mental health issues, I had a clear answer, and like this one thing, I bought this particular crystal and it solved all my problems or whatever. And that's certainly not the case. But I think it forced my hand to address how I was really feeling about my body changing and getting older in general. That is, your body getting worse is not something unique to hemophiliacs. That happens to everyone as they age. We probably just have to deal with it a little sooner, and that's okay. And you might be forced to face what that means to you. And I think that was the scary part. I didn't quite know how to do that. I certainly didn't want to do that. I didn't want to have to deal with the, additional anxieties or additional days off or whatever it meant in my mind. And honestly, I think the best advice I can give is just talking about it, because I think that that's what worked for me. I had this thing going on that felt separate from my hemophilia, but was undeniably connected to it. And when I just brought it up to my friends, not even with the expectation that they could tell me what to do or would even necessarily make me feel better in the moment, I think just bringing it up to them and saying, hey, I'm experiencing this thing, and letting them respond with, wow, dude, that sucks. It doesn't seem profound in the moment, and it might not give you the relief that you're looking for in the moment, but something is happening chemically in your brain when you are venting that stuff and you're shining a light on it that makes it less powerful. It makes it less potent. And I truly believe that is how I got past this time in my life. I just focused on it and really dissected what it meant to me that my body was getting worse, and kind of learning again to love my body despite that, coming to peace with that, and talking about it openly. I think another big piece was therapy, having my friends and family in whom I could confide, but an additional person who is kind of separate from those people, who can be another ear. And I think like explaining to them hemophilia and what was happening and what was causing the anxiety, and hearing them kind of say, yeah, like I'm new here, but that makes total sense to me that you're feeling that way, was a feeling of validation that I don't think I could have gotten anywhere else, unless I pulled a stranger off the street and explained it to them. But this was like a trained professional who was able to validate my feelings of anxiety and letting me know that my brain wasn't necessarily misfiring when it was making those connections and making me anxious, And I think that's all I wanted to say. I wanted to talk about anxiety generally. If you're feeling something similar, I hope that we can connect and that you feel seen. And if you haven't felt this way about bleeds or your hemophilia generally, or your bleeding disorder, that's fantastic. Just keep an eye out for that. If your body is changing and you're finding you're in a particularly difficult phase of your life with your bleeding disorder, check in with yourself and express that to your friends, and be mindful of the fact that your body can kind of rebel and say, hey, I'm scared. And you can tell it, that's okay. That's okay. But we gotta keep going, and everything's going to be okay. Thank you guys for listening.
Again, y'all, Sanofi aims to raise the bar for patients living with hemophilia. Reimagine what's possible by visiting rareblood.disorders.com to hear more about Sanofi's dedication to the bleeding disorder community.
And I want to give a quick shout out to everybody at Sanofi who supports the work of the BloodStream podcast and Believe Limited. We appreciate the partnership with y'all. I hope you know that. I hope you feel it. And thank you for all the support.
Here.
Max is getting surgery. So I love Max.
Who doesn't? Who doesn't love going to like some national meeting, and seeing Max Feinstein walking down the hall towards you?
He's also one of my favorite people. If I see a Facebook post that's stirring up a little controversy, that's kicking up a little dust. All I want to see is the comment from Max. That's it. I didn't even read the whole post. I just scroll for whatever Max.
I know.
What angle is he jumping in on?
I know, he's a legend.
But we talked about surgery recently because Max, as he will get into momentarily and has shared about here before in the podcast, has some pretty gnarly damage to his elbow. Which comes up in his life as a musician amongst other activities of daily life. So he brought up to me, hey, I finally found the doc to get surgery, and because I can't just be a friend and also have to be a content producer, I said, can we talk about it on the podcast? And he said, yeah, man. So that's the plan.
I will say, we say all the time, like, tell us your stories and things. I think, again, here we are. We're going to talk to Max about surgery. But one of the things I love about this podcast, you were so eloquent and open and candid about your own surgery journey with your ankle. Max is going to talk about his surgery journey. It's important for us to share those stories here, and I hope this is like a safe space. So if you're going through a life transition or maybe want to like share your tale, we tell you to reach out to us all the time, and that's like the thing. So anyway, hats off to Max for doing this.
All right, let's get to it. Here's Max. All right, Max, let's start on the important stuff. You just got a new tattoo?
Yeah. Somehow I kept missing Florida while trying to get ink in every state that I can, and I was just saying that I got kind of a flamingo popping out of the Florida seal wearing sunglasses a la Porky Pig. And I just heard that you guys interviewed the voice actor who does Porky Pig for something else.
Belief Limited touches more things than one may anticipate. By the way, flamingos are amongst the things that my daughter mispronounces most adorably. She calls them flamintigos. Flamintigo, which I think might be better. I think she may have improved that word, actually.
More syllables is more better.
I could talk about tattoos and nonsense with you for an extraordinary period of time, maybe a future podcast, Tattoos and Nonsense with Max and Pat. Not my worst idea. But we're here to chat a little bit because you've got a surgery coming up. And as listeners of the podcast know, I had a surgery at the end of last year, corrective surgery on my left ankle. That was a year after my first corrective surgery, and it was a little bit of an ongoing thought process, decision process, engaging with community and medical professionals about what's the best move here, because after all, we're talking about permanent surgery. So Max and I chatted about he's got this elbow surgery coming up. Let's talk a little ahead of time, immediately after, and then a little bit down the road to just kind of follow along his journey to some degree. And that's the point of this little series of conversations we'll have. So Max, in a few sentences, give us the backstory with your elbow. We're all generally familiar with a target joint and such, but what's your situation with your elbow?
So at 17, I developed a target joint in my right elbow that was deeply, deeply uncooperative for a while. And by the time I was 21, I was diagnosed bone-on-bone arthritic in that elbow. Now at 36, some 15 years later, and 7 or 8 surgical consultations later, I find myself at the Mayo Clinic being offered a surgery that the previous surgeons said wouldn't be possible to do, which is an arthroscopic synovectomy and debridement. They said it wouldn't be possible because there just wasn't enough space inside the joint to fit a camera, that any procedure on me would have to be open. And this didn't seem to bother. The gentleman's name is Dr. Mori. It did not seem to bother Dr. Mori at all. I'm not the first hemophiliac to go under his knife, which is also an extreme vote of confidence for me.
For sure.
It was not a difficult thing for me to accept this surgical offer, because it's literally the first offer I've ever had in 15 years and multiple surgical consultations.
So for you, it wasn't so much reaching a certain level of pain or disability or a certain level of emotional comfort with the concept. For you, it was a matter of advancement in surgical technology and procedure and strategy. You just never had the option until now. Is that right?
Pretty much. It may be that this gentleman is simply a cut above your garden variety elbow surgeon, which is
that was a nice pun. I'm not gonna let that go by. That was a nice pun.
I didn't even know I did that. Dear God, I'm slipping. But the truth of the matter is Mayo Clinic is probably just that good. And the reality of the matter is that elbow replacements or elbow surgeries are a lot trickier than most other joints to work on, if only because they're far less frequently performed. That was something I learned through all of these different consultations. The last guy basically said, look, why don't you just talk to the Mayo Clinic already? You're out of our league.
So, but now you're not getting a replacement. You're getting a synovectomy and the debridement. Is that correct?
Yes.
Gotcha. So removing the lining and cleaning out the inside of the joint of junk, essentially.
And the goal here is to improve on my motion mid-arc to try and stop the joint from locking up. The strength is there. I have a freakish amount of range of motion given the amount of damage I have. Yeah. By every single doctor in hemophiliac's account, this shouldn't be. Moreover, the intention here is to try to kick an elbow replacement as far down the road as possible, if not off of the road entirely, by getting rid of the synovial sac, which at this point is clearly an irritant and of no help to an elbow that really kind of isn't there anymore.
So what's your, we're recording this on November 15th. What's your surgery? Do you have a date?
Yes, it is February 13th.
All right. So you're about 3 months out, almost exactly. What are you thinking about between now and then? Are there certain things you want to make sure to get done, questions you got to ask, insurance things you got to do, physical therapy you got to think through? Like what are the things between now and February 13th?
Well, to go with the last thing you said, I am rededicating myself to a PT regimen for the sake of being in as good of physical shape in that arm as possible for the actual rehab. The other thing, to touch on insurance, I'm in New Jersey, and the New Jersey marketplace is called Get Covered. And Get Covered is lovely, save for if you have to have procedures done out of state, because it only offers EPO plans, I believe. You have to go off of the marketplace and get insurance on your own if you need something else. So currently my move is I'm working with the Mayo Clinic and my insurance company to get a gap exception. And that is where the provider writes to the insurance company to say there's a reason he's going to me. I'm qualified to handle this. Nobody else he's seen is. And that's why you should cover this. And if they agree, it will be covered as a tier 2 provider rather than an out-of-network expense.
Got it. Okay. So those, there's always the logistic things that you have to do by a certain date, or else it pushes everything else back. So it sounds like you've got a good handle on that and those kinds of things. Is there any fear or concern on your part?
I can't imagine anything worse than what I've already been through.
Yeah.
I have come at this point to an appreciation, and I've come to this appreciation through something I never thought possible. The conversation I had with Dr. Mori felt as though I was being addressed as an is rather than a was, if it were, as it were. That I was being addressed as somebody who could have something done for them rather than, listening to a doctor kind of suck their teeth while they look at my x-rays. I'm sure you've had your share of horrified providers looking at your imaging, wondering how you're not screaming your head off.
Yes, sir.
So with that, I was
yesterday, actually.
I would love to see a series on that. We showed 5 different surgeons a hemophiliac's imaging, and your response will shock you. It's sort of the truth of the matter is it can really feel dehumanizing after a while. To hear for 15 years that nobody can do anything for you except maybe flip you a Celebrex or something,
Yeah, and yet your story is also a testament that you got to stay connected to community, to information at a minimum that is trustworthy and credible and up to date, because in your case, Max, if you had just been like, well, there's nothing for me, this is just what it is, and disconnected yourself from the network, then you would not have been made aware that there's a surgeon at the Mayo Clinic who could do something for you. Things advance. I learned that with my ankle stuff because I had this notion that ankle replacements just weren't even an option. And as it turned out, in my specific instance, because of the integrity compromise to my left ankle, it wasn't an option for me. But it is an option. It's just I have this antiquated idea because 20 years ago it wasn't. So we have to stay connected because things do change, and sometimes for the worse, but sometimes for the better.
Now, here is one thing I do want to discuss. It wasn't an option for me, speaking of joint integrity, but having done my research, Dr. Mark Mori is published as seemingly pioneering an elbow surgery that effectively is supposed to graft Achilles tendon from a cadaver into the joint capsule as effectively like a spacer.
Wow. Okay.
Like as a fulcrum kind of thing. Except you have to have enough of an elbow to begin with in order for the graft to, I'm not
That's where you
in
don't
that position.
Qualify. Okay.
No, but it sounds really cool. And if it were all about what's the coolest sounding option, you bet I'd go for that because that just sounds really cool. But I'll also at this point take what I can get. And to realize that I've spent the last 15 years, I wouldn't say on my own, but I would. It's nobody's fault that this is taken as long as it has. And that was what made a lot of this hard. I was very angry at the world for a very long time. And over that time, I managed to figure out how to get along, but I had to be the one to do it. I had to be the one to go to bat for myself. I had to be the one to go against certain schools of advice because it didn't feel right for me to, lock up my joint until it's stabilized. That's a terrible idea. Muscle atrophy will set in on that, and so what do? You just try to live your life and get by either on what you have in you or what they give you. And I'm relieved that somebody is willing to take a shot on me on this because I was ready for that. I was ready to have – I probably would have been ready earlier too, but just the fact that I felt so humanized by this interaction, it speaks volumes to what I was just letting slide in my own head too. To feel more person than disease, You know, because when you have an unmanaged condition like this, I feel more like a disease with legs than a man half the time. Like,
oh, brother.
Yeah, I'm sure a lot of us can relate to that. And I hope everybody gets an opportunity to feel as humanized as I did by this experience. There is an HTC in the Mayo Clinic that I'm coordinating with my team, which also gives me an incredible vote of confidence that there is an in-house HTC.
Yeah, I actually gave a talk there a few years ago. I did a keynote there, and I just yesterday or the day before had the little like, hey, remember this from
in Minnesota?
From the social media. Yeah. And Facebook was like, remember when you were there? I was like, oh yeah, that was neat. I want to highlight one other thing, Max, before we start to bring this to a close. And that is like, I'm so glad you spoke to the anger because that's real. And even though it is no one's fault that it took this long, and it's no one's fault that you were, and are in the pain that you're in and have what you have, you also have the right to be angry about that. I have the right to be angry about that. And I remember once journaling, it's hard to be angry and have no one to hate. And
that's a really good one. That's really profound.
Because we create villains when we don't have them, and we project things onto people when we don't feel like we know where the emotion goes. And I understand what it feels like to be really angry and upset righteously and not know where to point that. It's a very, in my experience, destabilizing experience, but it's real. And I think a lot of us in our shoes go through our version of it. So I want to give you some kudos for honestly sharing about that, because it helps me to hear you talk about it.
It helps me to feel, because it literally defies my imagination that this is happening for me. And all I can do is hope, like I said, that any patient can feel as humanized as this interaction made me feel.
Well, we're not going to end anywhere better than that. So let's call it there. I actually want to talk to you again, maybe just before the 13th, so we can have one more, brief conversation before the surgery and just kind of hear any updates from you on it. But thanks for your willingness to let us into this part of your experience. And I'm hopeful for you, man. I mean, my surgery on the ankle has been a real game changer, and I'm hopeful that your elbow surgery is too.
Thanks, man. It's my privilege to share.
Thank you, Max. Thank you, Michael. Thank you, Sanofi. Thank you, Takeda. Thank you, Keith.
Yes!
Thank you, Kay. Thank you, Japneet. Thank you, Tony. Thank you, Leslie. Thank you, Jade. Thank you, Rob. Thank you, Josh. Thank you, Drama. Thank you, Amy.
Yes.
Thank you,
Ed
Ryan. Thank you, Ed. Thank you, Bella. Thank you, Avra. Thank you, Jay Rich. Oh, man, I really didn't want to do that. I wasn't planning that, because it's just, you're setting yourself up for failure.
I know.
Did I get everybody?
I think you got everybody.
I hope so, or else I'm going to get a nasty comment during the holiday party.
I know, it's
going to be like... And I don't.
That's our Believe Limited team who makes this stuff possible.
Thank you, and we will be back at it next year after a very nice break. And with that, that is all for this episode. Be sure to subscribe. Come on, at this point, would you please already? Are we here? Really? Subscribe.
Honestly,
tell others. Subscribe for them, especially if they're older and can't figure out technology. Not that I'm ageist.
I know. It's totally a vibe. And email us, of course, those stories. We want to hear from you. This is your podcast as well. It's about our community, your community. So email us at mailbag@bloodstreammedia.com, or you can find us on social. Patrick's on social.
Amy's on. Just DM Amy.
Just
send
DM
private
me
messages.
or DM us at bloodstreammedia.com.
Amy Bradford at allthosesites.org. I'm your host, Patrick James Lynch.
And I'm your other host, Amy Bradford.
And until 2025, take self-care of yourself. Happy New Year. Bye, everybody.
Love you.